Good morning or afternoon to everyone. Thank you for spending some time with us talking about ACA compliance for brokers. My name is Robin Carlini. I'll be the webinar moderator today. Just a little disclaimer about SyncStream. We're an ACA compliance company. We are not legal experts. So, you still want your legal counsel to go to for that legal advice. And a little housekeeping, this webinar will be recorded and it will be sent out to everyone that registered by Stacy, who I'll introduce in a minute. And if you have a question, please go to your Q&A box in the Zoom webinar. It should be at the bottom of your screen. Type in your question and we will answer your questions at the end of the webinar. And also there's a survey when you exit the webinar. If you could take a minute and answer those questions, that helps us out with our next webinar. And also in the chat function, I dropped our SyncStream website and our latest blog. We're celebrating our 10th anniversary as a company this month. So that is our latest blog. And Stacy Davidson is our Director of Broker Alliances here at SyncStream. She will be presenting the webinar. She is in charge of all the brokers. She has been with us nearly since the inception of the company, as well as Affordable Care Act.
Thank you, Robin. Thanks, everyone, for being here today. I really do appreciate it. I know everyone is busy, so appreciate you taking the time to learn more. And if you're going to end up watching this, for those that have registered and watch this later, I do appreciate you taking the time to watch this as well. I'm excited to share with you some information today. We're going to keep this short and educational. We're also going to provide you with some resources so that you can follow up, or if you want some additional information, you know where to find it. So SyncStream and the broker community have been working together since 2013. As Robin mentioned, we are celebrating our 10th anniversary this month. I started working for SyncStream almost 9 years ago, and I remember part of my first responsibility was doing the demos, and most of the demos were to the brokers or to their clients. And so that was our outreach in the beginning. Many of you, or your colleagues, if you were around back then, were interested in how this was going to affect employers. Boy, have we come a long way. When we were doing when I was doing demos on the tracking back in 2014, end of 2014, even the beginning of 2015, remember, we had a great system to track benefit towards benefit eligibility towards full-time employees. And they would say, okay, what's next? And we said, we don't know, because the IRS hasn't told us what's next yet. So it was fast and furious to get everyone completed for that first year in 2015. A lot of people were probably surprised that the ACA is still around. It's here to stay. We have become very passionate about working with our clients to make sure that their compliance is in great hands. I specifically say that I give the broker community the peace of mind that your clients' compliance is in great hands. And what does that mean? I know that your clients are important to you. So if your clients, I'm going to give the same courtesy to you to make sure that you know that your clients are that important to me. We believe in helping clients minimize penalty risks. I believe in helping your clients, be successful in this. I know you guys are busy, so let us do the work for you, and we can assure you that, your clients are in great hands. So a little bit of a scorecard, how long, how many employees we've tracked and forms produced, and, companies we've worked with, and specifically look at the mitigated penalty risk. To me, that's an indicator that the IRS is, not holding back on sending penalty notices. We like to say around here, the IRS considers employers guilty until proven innocent. So when we look at the mitigated penalties, either it's somebody who's come to us that used a different vendor, or they've gotten a notice and we've worked on their behalf to mitigate those penalties because of, an oversight or something like that. We're here not to just do the reporting. We're here to do it in a compliant manner and also work with clients after the fact. or new clients that find themselves in trouble because of a different vendor and not having their compliance buttoned up. So what led me to want to conduct this webinar today, because I know that it affects many of you and your clients, is that back in February, there was a regulation change around the e-filing of forms to the IRS. That regulation has a new limit that certain filers will have to start using e-file in 2024 for their 1095 and 1094 forms, specifically as it relates to the ACA, but also commonly used tax documents such as the W-2 or 1099 forms. If you remember, initial regulations said that any employer who had under 250 forms could simply mail them in. The IRS has changed that regulation to say any employer with 10 or more forms now needs to e-file. What a vast, difference in the amount of forms, and that will affect, I don't even, thousands of employers at this point who have been mailing in those forms. As we go on today, we'll talk about how we can accommodate those who have been mailing in their forms because they have a way to produce the codes on their own. Or we'll also talk about us fulfilling, the whole process for your clients if so needed. But just keep in mind that it's time to prepare to find an e-filer now. We'll talk a little bit about the TCC code or the IRS AIRS system. If an employer plans on doing this themselves through their own system, well, we're here to let you know that that is quite an extensive process to apply for that TCC code and to get on the AIR system on your own. And so we don't want anybody to have the burden of being caught at the last minute without a vendor to file. So maybe they are in the works of doing this on their own, but we're always here as a backup, obviously, in case that they need it. But I guess the major thing is just to make sure that everybody is prepared. Let's review the deadlines. So in the event that someone is still under that 10 form threshold and they have been mailing in those forms, they have a deadline of February 28th to mail those in. Now we know that's a very small population of employers. That could be obviously B forms that they're mailing in. They will have to get those B forms into the IRS by February 28th. The majority of employers now are obligated to furnish the 1094 and 1095 forms to their employees with a postmark date by March 2nd. And that is, the print and mail fulfillment of the IRS regulation. Anyone with 10 or more forms are now required to e-file any 1094 and 1095 forms to the IRS by March 31st. I'm going to assume that the IRS may not be adequately prepared to accommodate for this new volume, just on a hunch, just kind of maybe going back to our experience from 2015. So I'm going to recommend, and will probably recommend, that people try to at least get this process going by March 25th. Maybe even earlier. The IRS back in the day used to just go down for maintenance. So we have no idea what will happen come the end of March. But we know that the IRS deadline, as long as you have that receipt ID by March 31st, you're golden. So just keep that in mind. And then for those who may not be able to make the March 31st deadline, just as a final reminder that really the penalties start to increase exponentially. You hit the maximum penalty amount after August 1st if you haven't met the requirement to get those forms into the IRS. This is unrelated to the new regulation, but just as a little tidbit for you guys, the regulation around individual state filings. Just wanted to bring a little bit, awareness to this. These 5 states say that if an employer, regardless of where the employer's headquarters is, if an employer has any employees that reside in these 5 states, they too want to get the 1095 form for those employees. It could be the actual 1095 form or a version of the 1095 form. We handle that as part of our year-end process, except for Massachusetts. You'll see a little asterisk there. Massachusetts, from what I've learned, doesn't play well with vendors. And so they expect employers to do this on a more manual process. We've tried, others have tried, and as far as we know, there's no way to make that part of our process, and other vendors have not as well. As just a side note, you'll see pricing range kind of all over the place for these state filings. We include complementary state filings to these states as part of all of our fulfillment. So there's no additional cost for having a one-off employee that needs to, be filed to any of these 4 states. So, let's talk kind of the basics of the 2 forms. There might be some confusion around this because, what does the IRS do that isn't confusing? We have 2 different 1095 and 1094 forms that are being used to report. The 1095B form and the 1095C form are the information returns used by employers to report about their employees, the covered individuals. So think about the 1095B and 1095C are the ones that are about the employee. They're going to the employee, and they're going to the IRS on behalf of that employee's story about coverage. The 1094B form and 1094C form are the transmittal forms that are filed with those B forms, and the B forms are about the employer. I'm sorry, the 1094 forms are about the employer. So the 1095 forms are about the employees, the 1094 forms are about the employers. We do both. So who needs to file a 1095C form and who needs to use a 1095B form? That comes down to really an applicable large employer. Most of you probably are familiar with this term. An applicable large employer is anyone who has 50 or more full-time employees or full-time equivalents. A full-time equivalent is a calculation around using part-time hours to calculate how many full-time employees they may, estimate towards. It goes into the calculation. So we're using actual hours by part-time employees to give them kind of a count in the full-time, count towards being an applicable large employer. There's a calculation around that. If you have any questions, about what that calculation is, we have information about that on our website that Robin has provided. And really any of these kind of core ACA terms or meanings, we have a couple of webinars that are accompanied by blogs, which give a lot of just basic information, easy to read, easy to understand. There's one on ACA for Dummies, and there is one on avoiding penalty letters. And those have been very, very popular amongst our broker community and their clients. But anyway, getting back to anybody who's an applicable large employer, whether they offer fully insured or self-funded plans, are going to do the reporting on a 1095C form. The 1095C form is the more complicated form. That is where we'll take census, plan information, specifically cost of the plan as it relates to employee-only coverage, and the offer of coverage, the dates around that, and populate what is known as the indicator codes. So that's a 1095C form. We'll talk more about that. Then there's the B form, and those need to be reported on non-ALE. So think under that 50 employee threshold, who are offering health coverage to non-employees who are rolling coverage, or those non-ALEs who, an employer that offers employer-sponsored coverage to non-employees that is over the 50 threshold could use a B form, and smaller employees, less than 50 full-time equivalents that are not subject to the employer shared responsibility provisions that are offering self-funded level funded, they need to file on a B form. It's a lot of B's, C's, numbers, this and that. So, hopefully I'm not confusing you too much. So while we know that there's C forms, B forms, 1095 forms, 1094 forms, let's complicate this even more. Just some brief, specifics about, the ACA, knowing that an applicable large employer is 50 more full-time equivalents, they are required to offer health coverage to 95% of their full-time employees, and that coverage must meet minimum essential, minimum value, and some affordability standards. We'll talk about that in a little bit. Not only do they need to offer this coverage, they need to report to the IRS via the 1095 and 1094 forms. And what comes into play is the pay or play penalties, employer shared responsibility provisions due to any employees going to a premium, due to the marketplace to get a premium tax credit, which could result in some significant penalties, whether it be the A penalty or the B penalty. So that's what is facing applicable large employers. Other things that complicate this, obviously, making sure that they're accommodating and knowing that any employee who works over 30 hours per week is a full-time employee, calculating and being aware of any breaks in service and knowing whether or not that employee, if they're being tracked, continues in that measurement period, if they come back, or due to the length, do they need to start a new measurement period? Aggregated companies, control groups also complicate this reporting for employees. The annual affordability percentage in those safe harbors is another complication. Like I mentioned, an electronic filer certification, that ACA transmittal control code, the TCC that an employer needs to access or have ownership of prior to being able to e-file on their own. And then obviously another complicating factor is penalty amounts. Nobody budgets for ACA penalties. Those can be, pretty, damaging to an employer's bottom line if they aren't, if they're surprised by that, obviously, and obviously not aware of the complications and some of the risk that they're facing with their ACA reporting. There are penalties for not meeting the reporting deadlines. There's penalties that can be affected by inaccuracy of the forms. Certainly there's the A penalty for not offering coverage to 95% of your full-time employees. There's B penalties that are triggered if an employee goes to the marketplace and they have not been offered affordable coverage or minimum value coverage. And then again, there's reporting penalties for not, penalties for not reporting. There's even penalties for not reporting if the IRS determined that you purposely just didn't do the reporting. I call that like one of the atomic bomb penalties. I'm going to turn it over to Robin.
If you could take a minute and answer this first poll, let me go ahead and launch it. What changes every year with the ACA? Is it affordability percentages? Is it part-time hours threshold? Or is it the applicable ALE number threshold? So we'll give you a few seconds to answer this. I'm seeing
Don't
some
worry,
good
we won't show any
answers.
answers.
No, we won't call you out. Okay, Stacy, it looks like 91% has answered affordability percentages, 8% part-time hours threshold, and 3% the ALE number.
Well, congratulations to those that chose the affordability percentages, option A. That is what we're going to talk about next. Oops, let me go back. All right, so this probably is one of the more complicating aspects of, or can be aspects of reporting. And this is where I feel like sometimes the broker community comes in. As we're working with clients, often in their onboarding process, we say, do you know which safe harbor you're applying in your reporting, or which safe harbor you've prepared to apply in your reporting? For us, that helps determine what additional information we need. Do we eventually need to get the W-2 box 1 wages at the end of the year? Should we be getting rate of pay information in payroll? And so it's a strategy that most are hopefully addressing with their clients at open enrollment when you're talking about plans and costs, so that one, you're ensuring that your clients are offering affordable coverage, and two, if they're doing the coding on their own, that they know which safe harbors will, be used as they're doing those indicator codes on 14 and 16, what the situation is, or if they're working with a vendor, they know what information that vendor is going to need. I know it starts at W-2, but I'm going to start at the federal poverty level first. The federal poverty level for the IRS has determined that the federal poverty level is $13,590. To determine whether the FPL safe harbor is affordable for an employer, what the IRS says is the way to do this is to divide the 13,590 by 12, multiply that by 9.12, which is the determined percentage that they are using for 2023 reporting. So you're taking 13,590 divided by 12, multiply that by 9.12. And if a plan, the lowest cost plan for employee only coverage, is below $103.28, then that plan will pass the FPL safe harbor. Our solution automatically runs this when we are working with the cost of a plan and the offer of coverage made to that plan. So once somebody knows that they pass the FPL, it's easier for us. We know that we don't have to get the W-2 or rate of pay, but as long as they're passing one of them, it's quite acceptable. Most employers that are offering no cost for employee only coverage, obviously they're passing that FPL right away. I would say that the second one that's easy to, accommodate is the box 1 wages. So again, that 9.12% comes into play. And the way that this is factored in for the W-2 safe harbor is that what an employee is required to pay, if it does not surpass 9.12% of their W-2 box 1 wages, then it's deemed affordable. So in that case, sometimes we're getting the W-2 information and we obviously will do the calculation. So as long as it does not pass 9.12% of their box 1 W-2 wages, then it's deemed affordable to them. The rate of pay affordability safe harbor. So that is the calculation for that is that you take the hourly rate, you multiply that by 130 hours. That's the full-time hours set by the IRS. So the rate of pay times 130, and then you multiply that by 0.0912, again, that 9.12%. If that number that you get is not greater than, this is why I had to write this one down, it gets confusing and I went last. So the rate of pay, so the planned cost for employee only coverage would have to be less than that number, allowing an employee to pass. So let me just be less confusing. You take the hourly rate times 130, then you multiply that again by 0.0912. And if the cost for employee only coverage would have to be less than that number to allow the employee to pass. Now, this can be done on an individual basis for employees, or the IRS allows a blanket approach using the lowest earning employee as the benchmark. So you take a look at all the wages for all of your employees, you take the lowest and you apply that. As long as that one passes for that employee, then you make that blanket assumption that it passes for everyone. Now, one thing to consider is that in 2021, that was 9.83. In 2022, it was 9.61. And now in 2023, it's 9.12. Lower doesn't mean better. This means that the IRS is making it more difficult for employers to pass these safe harbors, to make sure that these employees are getting affordable health coverage for employee only. It's very important that all of this applies to employee only coverage. So regardless of whether or not someone has been doing the coding on the C forms themselves in the past, using a workbook, doing it manually, using a vendor, and all they're looking for now is someone to e-file because of the regulations. Or if your client or an employer needs somebody to really help and do the calculations, we have the answer. We've got two different avenues for employers. We have a total ACA, where you think about we're doing the coding, we're going to get the plan, we're going to get the census, and we're going to get the offers of coverage. We'll take into account the safe harbors. We call that total ACA. Or we have simply a file and mail, which is the fulfillment now. This piece is what kind of breaks that, takes that client from mailing them in on their own to now meeting the new regulations, I should say. So we have options within that. With ACA file and mail, for C forms, clients are going to provide the indicator codes. SyncStream will audit the indicator codes. So that is going to make us stand out from most vendors. So even if your client was using a workbook to do the coding, they're doing it manually. Once they come to us for the fulfillment, we're going to audit their codes. And I'll show that a little bit. What we're going to do with auditing the codes is allow them to address any potential penalty issues or red flags before going to fulfillment. No sense in going through all this work to then send something to the IRS that isn't even an accurate account of the offering, right? So if there's an issue, we're going to allow them to address that before they send it to the IRS. For the B forms and the C forms in this ACA file and mail, it's a simple Excel import of data. We'll handle the fulfillment to the employees, the IRS, and the states. For ACA file and mail, that is self-guided with the templates and resources provided. And we provide a lot of resources to help guide clients through this. For total ACA, if we're going to get the plan, the census, the offers of coverage to produce the forms, that's called total ACA. We have that in a self-service offering where, the client will be self-guided with templates and resources. We're going to audit the codes and we're going to handle the fulfillment to the employees and the states. We can take it a step further where we can provide total ACA full service. We're still going to get that data to produce the codes. We're going to audit the codes. We provide the fulfillment to the employees and the states, but full service will be provided with onboarding, scheduled data cadences, touch points, guided workflows, in the event that someone needs that extra hand-holding to get this done. Sometimes this is, necessary if there's been a change in personnel or a new company that's filing for the first time. They will learn lots from our team. Most of our team has been with us, 95% of our team has been with us since inception. We're passionate about what we do. We believe in educating. That's why we do monthly webinars and, on topics like this. Additional benefits of using us, and again, it's kind of a reiteration, is that unlike them being just mailing in those forms in the past, our solution is going to audit all of the codes on the 1095-C forms prior to fulfillment and to identify any potential penalty risks. And that fulfillment is going to include print and mail of 1095 forms to the employees. We also have an option for electronic distribution, and then the IRS e-filing and any state filings are included. Obviously, we're an authorized e-filer. Just some key features of using our ACA file and mail, which again, we take the template of information and finish the process. We're consolidating the information you provide. We have a template and really a guided, step-by-step guide. All of the laws and regulations are built in our solution. Unlike a workbook that may have been used in the past or doing it manually, we have all of the proprietary business logic for laws and regulations built in. An audit is run to flag potential penalty risks. We do the fulfillment. We do the state filings. What's also different is that when employers in the past were mailing in those forms, it just went to the mail. A lot of times you hear from clients that said, the post office, it looks like my dog ate my homework. I mean, they'd come back with a mangled mess, a package going to the IRS. What's different is that now we can give you timely and visible IRS receipt IDs right there. You get the receipt ID, you know that it's gone through, you get your status of accepted with errors. We can help you identify the accepted with errors, those errors being commonly name and social mismatch. We can do that, identify them there. You can identify them on the form, make the correction on the form, and easily resubmit for that filing if you've made any corrections. We do not charge for corrections. We also have a tax form repository. It's a one-stop place to go and see all of your records as it applies to that year. And that's where all your PDFs for the forms will live. And our customer service is accessible through a secure ticketing system that's timed and tracked for responses. We are very big in mitigating risks. If we're doing if they're going to use us and import their templates into our iSync. It's our intelligent import tool. It's going to run the data through thousands of rules to ensure compliance, chronological order of events, adherence to form specs, etc. Everything with the IRS and the ACA, has to do with rules. We're not going to allow a term date to come in before a hire date if we're doing, the population of the codes. Even if it's on the ACA file and mail, we'll see an extra digit somewhere that doesn't belong. We're going to flag that and not allow that to go further into the process. We've got lots of auditing in the solution to help with past year filings and assess potential penalties. Obviously, we're addressing current year for any potential issues and allowing clients to address those before fulfillment, and just some other really neat functions of our audit tool that includes assessing penalties if you decide not to offer coverage, or if your client decides not to offer coverage to 95% of their employees. So just, in the event that you want to get a deeper dive in anything related to some analytics of the reporting and penalties and some numbers, we have that audit tool that can provide that. I don't know if you can see this, but this is a picture of what we do for the 1095C forms prior to fulfillment. There's an red triangle that indicates potential penalties. There's a little exclamation point that says there's some missing data. So maybe it's a missing social, as I can see. This is what the screen looks like. I just wanted to give you an idea. This is a little bit more close up. It actually identifies what the issue is. It says, so this is a 1H and blank. If anybody's familiar with this code combination, that means that the employer did not offer coverage to that full-time employee. And that if that employee goes to the marketplace, there could be a penalty. So this would be right away, allows the employer to know that, hey, let me go back and see if the invisible man made an offer of coverage. Did we miss just importing him into the solution? That will happen in the ACA file and mail solution option, or our total ACA option as well. As if you're ever familiar with the indicator codes, it's confusing. It's just a number and a letter that the IRS is using, multiple combinations to tell the story about the offer of coverage and the affordability that employer has made to that employee. In the event that someone wants to use the total ACA, meaning we populate the forms, the codes on the forms and such, we've got accurate monthly monitoring, lots of reports to help forecast towards benefit eligibility and tracking. We have A and B penalty compliance reports in real time showing that they haven't maybe made coverage to 95% of employees. They can actually see what the penalty amounts would be. We guide employees through the year-end process, addressing the penalty flags that come up, just safe harbor calculations in real time, ICRA calculations if they're doing ICRA plans, you know, just everything that you can imagine that goes into the populating of the codes to maintain compliance. We're doing that in the solution. If it's been a while since you've seen a demo, I invite you to join me for a demo. You'll be amazed at just what we've provided to employers. There's just should be no question if they're running into any potential penalty risks. And then always have the option to add on a dedicated compliance expert with our full service. I'm not gonna, you know, this is just, you know, reiterating everything that we do as part of our total ACA package. We call it the Sing Stream difference, really going through all efforts to make sure that employers are operating with minimal penalty risks, addressing them if we need to, and making sure they stay compliant. We have our technology allows us to bring 3 layers of protection. We have the iSync intelligent import tool. We have compliance technology that we are having vetted twice yearly by an outside legal counsel to keep up with all the ACA regulations. And we have our staff who have been trained, have unparalleled level of experience working with clients for over 10 years through these processes. This gives you a real quick glance at what the affordability safe harbor breakdown is. We're doing the federal poverty level in real time. If we have rate of pay, we can do tracking on rate of pay affordability in real time. And of course, we could get the W-2 safe harbor information needing box 1 wages after the year. All 3 of these, you were able to see the results, and then the results being a very detailed report on what the parameters are to passing or failing that safe harbor and you know, how that employee fared. This is a quick shot of the A penalty risk. It is about not offering 95% coverage to 95% of your full-time employees. We hyperlink the employees that are contributing to this calculation. We hyperlink to the employees that are actually provide, you know, the number of employees and who that is that are factoring into this penalty. And then you could see what the penalty risk is there. We also do it for the B penalty, what that penalty risk is, how much that penalty would be, how many employees are not offered coverage or MEC only coverage, and how many employees were offered unaffordable coverage. And I'm going to stop. That was a lot of slides. Go ahead, Robin.
Thank you, Stacy. I'm sure you need a minute break. Our next poll. What is the biggest challenge your clients face regarding the ACA? Is it meeting the affordability safe harbor guidelines, an understanding of compliance risks, waiting too late to start their reporting process, an unreliable ACA solution, or IRS 226J letters because employees go to the marketplace? If you could answer, and we realize there might be more than one answer, but what is the biggest challenge?
And of course, there's no wrong answer in this either. We just wanted to get an understanding of where you guys may be in the daily conversations that you have with your clients about this.
Okay, thank you for the participation.
Yeah.
42% an understanding of compliance risks, and the other big one, 36%, waiting too late to start the reporting process, which we are very familiar with that one.
Well, I have to say kudos to you guys, because not many of you said that meeting the affordability safe harbor guidelines was a issue. So that is kudos to you guys for addressing that with your clients and making sure that they are meeting, the affordability thresholds, which also goes into play that not many of them are getting the IRS 226J letters. Hopefully, they've gotten that buttoned up as well, but not surprised at all, like Robin said, that waiting too late and an understanding of compliance risks would be leading that poll. So appreciate the feedback there. Let me go back one. So obviously we can take a look at all of this as it relates to the ACA and realize that, wow, it can be a tornado of issues, things to consider. No doubt that all of your employees have one specific person dedicated to ACA, correct? Doubtful. We know that while they're in charge of ACA, they are in charge of other HR functions. They're spread thin. We understand that that is just a problem facing a lot of HR departments these days. They're doing it all, right? So in the event that someone needs full service support, this is what our full service support program involves. So I just wanted to highlight that is an option. For some that are more savvy, they may be able to do this, the self-service for total ACA on their own. But in the event that they've had some turnover, like I said, this is their first time, they're really just overwhelmed, they can't keep up. If they want to choose full service support, it comes with initial training, data support, ongoing support with regular touch points, unlimited access, really, secure ticketing system, Zoom meetings, email, phone calls. Let me just tell you, this doesn't happen very often in this industry, right? A lot of people can't get in touch with the company, their vendors that they're using for ACA and other HR services. And then we're going to review the compliance reports. We're going to say, hey, you're up against maybe a risk here with an A or B penalty. We want to pay attention to the data cadence. We don't want to recreate what has happened for the whole year when it comes to November or December. We go through the year-end process, the audit of forms, and obviously the fulfillment. Real quick before we move on, and we only have 2 more slides left, so I appreciate your time here. Look, using us for ACA file and mail is maybe what the majority of you guys are looking for because somebody has been mailing them in. And we certainly will do an amazing job to help them fulfill that. In the event that maybe they no longer have the ability to do the coding on their own, that's why we wanted to show you what our total ACA package is all about. And in the event that they need full service support, we wanted to introduce that to you as well. But if your clients need simply the ACA, the 1095B or C forms, and just a way to get them to the IRS, just a way to handle that fulfillment, we can do that very easily. We've got the templates, we've got the solution to help them and be better prepared than they have been in the past by just mailing them in. So SyncStream has joined some other HR compliance companies to provide other solutions. We now are under an umbrella called HR Logics. We also can help with Form I-9 compliance, tax credits, maybe work opportunity tax credits, R&D, disaster, some things that can help you bring some additional value to your clients, unemployment claim management, and employment and wage services. Employment and wage verification services. Just like with SyncStream, we do it with state-of-the-art technology, best in class customer service, and really a workflow that allows employers to be successful. And we are able to tie all this together where we will be able to share data from one source to all the rest. So in the event that you have any clients who may be looking for other services, give me a call. We can talk about the opportunities to help them with these. And then Robin's going to handle the survey.
Yes, just upon exit, these are the questions that will pop up in the survey. If you could just take a moment to answer before you completely exit the webinar, we would appreciate it.
And just on a final note, I'm here to help support you guys in any way that I can. That's my job. What does that mean? I can do webinars for you. I can help your clients determine their compliance risks. I can be, answer the question, be the answer to the questions that you may not know, because you need to focus on what you need to focus on. Let us focus on ACA. So reach out if I can help you in any way. This is my contact information again. And we'll go to, I think we have a couple of questions, but I just wanted to make sure that you saw my email and phone number to contact me in the event that you need anything.
Yes, Stacy, I will read the question. If an employer meets the ALE threshold the previous calendar year, and now they're subject to pay or play, when does that plan have to meet affordability? Is it at renewal or sooner?
So if they became an ALE, let's say in 2022, then they're reporting on 2023. They need to be offering affordable coverage in 2023.
That is, yes. And do ALE employers have to provide a copy of the 1095 to the employee? Or do non-ALE employers have to do that as well?
Both ALEs and so ALEs will have to provide the 1095C form to their employees. And if a non-ALE is offering self-funded, level-funded coverage, then they're required, only if they're offering self-funded or level-funded coverage, then they are required to use the B form. If someone is a non-ALE, let's say they only have 30 full-time employees and they are in a fully insured plan, they don't have to worry about this at all.
And we can stay on for another minute. If anyone has last minute questions, please type it into the Q&A box. But as we stated earlier, this webinar is being recorded, and Stacy will follow up with all registrants and attendees with the recording and the slides upon request. Oh, we have another question, Stacy. Oh, it was just a thank you. You're very welcome, Carol.
Thanks for joining. I really do appreciate you guys being here today. We'll hang on for a couple minutes for questions, comments.
Yes, we will send the slides as well, is the question. Thank you for all the positive responses. We appreciate it. We like to hear it. And if you have any future webinar topics, I believe that's one of the questions in the survey. I mean, we use this feedback to create another webinar for you guys. Okay, Stacy, I think that is it for today.
Great. Thank you.
Thank you so much for your time. We appreciate it.
All right. Thank you. Thanks, everybody. Have a great day.